Hey all, this is Professor Fay with your anatomy lesson of the day. If I hold this up, what does it look like? Kind of like a tree, right? Well, this blue stuff, this is called the bronchial tree, which we're going to get to, but really everything's oriented this way in your body. So it'd be kind of here on me. So we've got, the first thing is the larynx, and so this is kind of way up here. This is the larynx. You've got the thyroid cartilage. That cartilage is what produces the Adam's apple, kind of a little pokey thing that you can see in some people here. That cartilage then, just inferior to it, is the cricoid cartilage. This is a complete ring of cartilage all the way around. It has sort of a wedge shape where it's narrow anteriorly and kind of wide posteriorly. And on that posterior side, you can actually see two little triangles in that sort of terracotta color. These are the arytenoid cartilages, mostly, with the very little tip there being the corniculate cartilage. The arytenoid cartilages are attached to vocal ligaments inside the larynx here, and they can pivot, and that's what causes different sounds to come, in part at least, different sounds to come out of your mouth when you speak. And so then we've got the trachea, just a whole bunch of tracheal cartilages. I'm not so sure that you can see. I tried to make a bunch of little lines to show that there's a whole bunch of tracheal cartilages that compose this. They have a C shape to them. And on the posterior side, the C's end, and basically each part of the C is attached by this little muscle called the trachealis muscle. It changes the diameter of the trachea just a bit when we're breathing. If we look on the anterior side, this is the last tracheal cartilage. It's got a little bit of a funny shape to it, which is why I put it in a different color. On the inside area there is the carina. This is particularly sensitive and produces coughs for us. The mucous membranes in there are pretty sensitive. And then the trachea ends up stopping here, and when we see the blue pickup, these are now main bronchi or primary bronchi. One bronchus goes to each lung, so there's one primary bronchus for the right lung and one primary bronchus for the left lung. Each primary bronchus then divides into a secondary bronchus, also known as a lobar bronchus. There's three on the right because you have three lobes of that right lung, a superior, a middle, and an inferior. And then there's just two on the left because you just have two lobes of that left lung, a superior and an inferior. From there, these secondary or lobar bronchi branch more into tertiary bronchi, also called segmental bronchi. And then these just keep branching into narrower and narrower diameter airways until we finally get to terminal bronchioles. That delivers air, those terminal bronchioles, into what will end up being our alveoli. And that's where the exchange of oxygen and carbon dioxide can take place between the lungs and the bloodstream. So that is your anatomy lesson of the day.